Welcome to this presentation on the benefits of the electronic health record for healthcare providers' clinic practice, presented by Katie Baye, Reagan McFarland, Blake Milam, and Deborah Utssy, with Deborah and Reagan narrating. The electronic health information systems is not the way of the future, but it is the here and the now. The purpose of this presentation is to convince clinic providers of the benefits. Changing to an electronic information system requires a change of culture, processes, and people. To quote Kurt Lewin, a German social psychologist, if you truly want to understand something, try to change it. We will discuss the financial, quality, and patient safety and clinical efficiency benefits of electronic health record implementation. To give a little background on the electronic health record and the health information systems, in 2004, President Bush issued a mandate that all healthcare providers would use the electronic health record by 2014. President Obama continued this vision by signing the American Recovery and Investment Act in 2009, and he committed federal funding of $19 billion to develop an electronic health information technology infrastructure. The purpose is to improve the efficiency and access of health information to all Americans. The program actually acts as a two-edged sword, as it is not only an incentive, yet it can result in payment penalties for those who do not comply with the program. Beginning in 2015, Medicare eligible providers who do not successfully attest and demonstrate meaningful use will have payment penalties of 1% each year, up to a maximum of 5% according to CMS. Financial incentives come in the form of increased reimbursement rates from CMS, and change within the health information system environment is gaining momentum. Providers within the health care clinic setting will be expected to comply with the American Recovery and Reinvestment Act. John Cotter's change theory relates to healthcare being in the midst of change as we are evolving to electronic health records. The change from paper charts to an electronic health record will tax the emotions of staff. The success of implementing this change can benefit from acknowledging Cotter's thoughts on the promotion of positive feelings of physicians and staff, motivation of their heart, not their head, and to buy into the implementation of the EHR. Meeting the criteria set by meaningful use would more efficiently be promoted through an environment of staff empowerment. Thus, behavior that is fueled by emotion empowers the employee to buy into the change. Once again, if you truly want to understand something, try to change it. The Office of the National Coordinator of Health Information Technology, the ONC, has been working nationally to develop and implement the Health Information Exchange. The HIE is an avenue for authorized healthcare providers to share real-time information electronically in a secure manner. Sharing healthcare information among healthcare providers' clinical practices coordinates care among the various healthcare providers that may have seen the patient. Therefore, healthcare costs can be reduced by avoiding repetitious diagnostic testing and procedures. The electronic health record simultaneously affords the benefits of improving the quality of health care, controls cost, and facilitates maximum reimbursement for healthcare providers' clinic practice. Healthcare providers' clinic practice garners financial benefits in the form of savings as human labor can be utilized more efficiently. Reducing labor-intensive tasks and manual billing practices decreases the need for human work hours and allows for one to circumvent that labor to another needed task. These cost savings of the electronic health record can be as a result from reduced costs for transcriptions, reduced time for laborious chart locations, and reduction of time and resources for manual entry of charges yields more accurate and efficient billing. Other financial benefits come from the automation of clinical documentation, order entry, and charge alerts. We can see more precise reimbursement coding. Higher compensated coding results from improved documentation. There's a reduction in the delay of billing, thereby preventing denials associated with late filing. Charge review alerts flag physicians if a test can only be performed at a certain frequency. This would avoid insurance payment denials. Alerts that prompt clinic providers to obtain insurance approval for certain diagnostics facilitates the avoidance of claim denials.
It's ironic, a person's complete driving record can be assessed in 60 seconds, and a complete health record is still within the ice age, leaving holes and chance for error. Therefore, the main goal of implementing an electronic health record is to improve the healthcare system, patient outcomes and effectiveness, quality of care, and patient safety. With change, some resistance is bound to occur due to the unknown. There are disadvantages to the implementation of the electronic health record for a healthcare provider. The initial patient census will decrease, which is expected with a learning curve, but know that this too shall pass, leaving the advantages to outweigh the disadvantages. There are multiple advantages of the electronic health record, which includes patient safety is improved by using a system that supports evidence-based care, which improves patients' outcomes. Patient safety is achieved by increasing medication safety. President Obama acknowledges an electronic health record would cut waste, eliminate red tape, and reduce the need to repeat expensive medical tests and save lives by reducing the number of errors in medicine. Also, the electronic health record saves on nursing and order turnaround time. For example, if the nurse needs a stat ABG, the order can be entered into the electronic health record and sent to the designated department, not allowing a break in communication. Another huge benefit of the electronic health record is it provides a real-time picture of the patient and creates a continued care document that can be transmitted to another facility if need be. Other advantages of the electronic health record is it increases follow-up care by sending patient reminders for appointments, mammogram, PSA levels. Also, the electronic health record better assists documentation for performance improvement for CMS, flagging criteria that must be addressed. Another benefit of having an electronic health record is the ability to set alerts for patient safety for abnormal labs and X-ray values that will potentially fall through the cracks. Legibility of documentation is one of the greatest advantages of the electronic health record, reducing the misinterpretations of orders leading to harm and error. Legibility and standardized documentation can also reduce malpractice exposure and decrease malpractice insurance as a result of having an electronic health record.
The ability to access a patient's full medical record has become paramount in providing safe and effective care while also improving health outcomes. The adoption of an electronic health record would allow you to access patient records, including office visit notes, hospital admission records, and updated medication lists in a matter of minutes. One major example of the benefit of this technology involves accurate medication reconciliation. Especially after a hospital admission, a patient's medication list may change many times over the course of a few months. By using an EHR, healthcare providers can accurately track medication changes since their last clinic visit and accurately make changes and treat any new issues using an up-to-date medication record. Another benefit of an EHR includes the reduction of duplicate testing and transcription orders, which facilitates clinical efficiency. Access to the patient's full medical record would allow one to see what tests were ordered by another physician and what those results were. Reducing transcription errors through physician order entry would reduce costs associated with unnecessary testing and would also reduce time-consuming phone calls attempting to rectify inaccurate medication orders. In some cases, prompt communication between health care providers is necessary to provide the best care for a patient with multiple health issues. Access to the EHR would make this process quick and easy because of access to other physicians' notes and patients' information. When using the EHR to access the most up-to-date clinic notes, hospital notes, medication lists, or reduce errors, the EHR can allow you to accurately treat your patients in a timely manner. Having this technology available in your exam room while you're seeing patients saves time, allows you to see more patients on a daily basis, and accurately treat the patient's condition with the use of updated test results and medication lists. We encourage you to gain momentum and consider Cotter's theory of change and buy-in to the electronic health record for your clinic practice to reap the financial benefits as well as ensuring patient safety and quality and greater clinical efficiency. For questions regarding this presentation, feel free to contact either of us through our course mail. References that support this presentation of information are provided.